Hello everyone, I'm President and CEO Mark Tarr, and this is Quarterly Connection. The second quarter of 2024 was a busy and successful quarter. In addition to providing my usual financial performance and growth updates, in this quarterly message, I'll take a few minutes to spotlight a new therapy program we're implementing across our hospitals to help improve our patients' quality of life. I'll also explain how this quality of life program is a result of our therapy innovations model in action. Let's dive in. It was another great quarter for the company. We continued to expand upon the momentum that we generated in the first quarter with the high percentage of total discharge growth, and saw that continue into the second quarter, where we had 6.7% total discharge growth. 4.7% of that was same store. So this continued need for our services and the aging population continue to prove out in our marketplaces. In addition to our volume growth, we also had a record number of additional beds built in the second quarter. So we added 170 beds across 4 new hospitals. One of those hospitals was categorized as a satellite. So we have new hospitals in Kissimmee, Florida. We have a new hospital in Atlanta. That was actually a unit within the Piedmont Acute Care Hospital. And then we added a third hospital in Louisville, Kentucky. And then the satellite was in an area of St. Louis, a suburb of St. Louis that we refer to as Town and Country, as part of our BJC partnership. So it was a great quarter in terms of adding capacity that we needed across our portfolio. So in addition to our volume and financial results for the second quarter, our quality outcomes were outstanding. If you look at our ability to get patients back home, back to the community where they came, that's our ultimate goal, versus having a patient discharged to a skilled nursing facility or nursing home, or if a patient has to be transferred back to the acute care hospital. Those are two outcomes that we try to prevent. But we had almost 84% of our patients were discharged back to the community, which is just outstanding. Those continues to be a new high for us. So tremendous effort and outcomes from a quality perspective, and we're getting those outcomes while also having record highs in terms of our net promoter scores or our patient satisfaction. So I'm very proud of what the company and what our caregivers are able to accomplish with our patients, which is a very challenging clinical mix of patients that we see. It's just a continuation of our use of data in providing and developing models to impact our patient care in a positive manner. You've heard me talk about the predictive analytics to use in our REACT model, which helps prevent patients from reaching a point where they have to be sent back to the acute care hospital, or our falls risk model to help identify patients that could be at a fall risk. This model is more focused on therapy and helps our therapists to identify areas for opportunity where we may be having voids in the opportunities to continue to address needs of the patients within therapy. So it is a continuation of our predictive analytics model. We're using data, we're putting it in place, and we're using it to improve our outcomes with patients. So our therapists are now utilizing a program that continues to look for opportunities or space maybe that we aren't currently addressing to help patients get back to the highest quality functional independence that they can. And part of this deals with looking at gaps that could be part of a patient's community reentry when they go back to the community. What is their mobility there? What is their social interaction back in the community? It's a way of looking at the needs of the patient that are in addition to, or really kind of like the next step beyond just the basic mobility or activities of daily living that have become a basic staple in what we do for patients in our hospitals. I want to extend a special thanks to our therapists for your efforts implementing our new quality of life program. But as with any new initiative, collaboration among many roles and departments is necessary for success. We truly are stronger together. So whatever your role, thank you for helping Encompass Health positively impact our patients, their loved ones, and the communities we serve across the country. Here's to a great second half of the year.